Lauren Barker. I'm looking forward to this discussion because we're going to talk a little bit more about bladder leaks. This is probably one of the main things that people come to see someone like myself, a pelvic health physio, for. And even if they have other symptoms, this might be one that they're also grappling with. And so, I wanted you to come on to talk about another option that we can offer people. So, just really briefly, first, Lauren, tell everybody a little bit about who you are and the company that you represent.
Sure. We're so excited to be here today. Thanks, Melissa. So I am Lauren Barker. I'm the CEO of Uresta, and we have a solution, a product that is a bladder support product that helps with bladder leakage. We are Canadian owned and a women-led business.
That's amazing. And if I could set the stage, I always want people to kind of have a frame of reference when they're listening to this because when I think people are starting to hear that there are more options besides surgery for bladder leaks. And so if I picture someone coming into like a physio appointment and they mention maybe that they have bladder leaks, I always ask when, and quite as often like cough, sneeze. It's when I run, it's when I lift my baby. Sometimes I feel it trickling out. Sometimes it surprises me in my underwear or what have you. But I often ask them first, like, what have you done so far? Like, what are some of the things that you've tried? And what do you know about this? Or what do you think your options are? And I'll like this is obviously mostly video that people are listening to. So I'm gonna have to describe without showing, but I draw almost like a spider web and I put leakage in the middle and then I almost draw little prongs coming off of that and I show them these are all the things that in the back of my head I'm considering. And I'll say, like obviously surgery is an option. Like I'll put on there the things that they've told me they've heard of before. Like you've heard of surgery, you've heard of pelvic floor physiotherapy. I'll say like we need to look at things like some of your habits, like are you constipated? Do you have a habit of holding in your tummy, which is something that can cause like downward pressure on the bladder and the pelvic floor? Do you squeeze your pelvic floor all the time? Some people will say like, oh my gosh, yes, I thought I had to squeeze those muscles all the time, but kind of put that into the category of habits. Like what are some of the things that you do that could be contributing to leakage? Also want to think about your tissue health. Like, are you taking any estrogen? What's your age? Like, just considering things like that. Um, Sometimes they've heard of things like the Amsella chair, like the quote unquote Kegel throne that some people have heard of. And I've covered that in a different episode before. Like, what are some technologies able to offer? And then obviously, like, what we're going to talk about today is like bladder support. Like, are there devices or, kind of like continence pessaries that people can insert that can help with bladder leaks. And so some people have heard of that, and some people are blown away that there are devices like this. And so when I pull that out, because I have one of your starter packs. We'll go into this in more detail, but I love having that for demonstration purposes so that I can show them what it looks like, describe it. But I often wish that I could send them home with a little bit more information than what's on the instruction manual or the descriptions so that they can listen to this conversation and make a decision whether this would be something they want to try or not. So that's just kind of, me setting the stage. We're talking about one of the tools today, and I love that you can be here to describe this better than I can.
Absolutely. So that's interesting that all the different approaches, and I think a lot of women do look at Uresta and don't quite understand how it might work. I think one of the biggest things that we get is it's something that's inserted vaginally. So women are like, why would something inserted vaginally stop my bladder leaks? But the best way to think about Uresta or a pessary really is it's something that's inserted vaginally. And it sits under the urethra and it sits under the bladder. And it basically supports the urethra. And so if you cough or you sneeze or you put pressure on your bladder during those activities, it will sort of hold everything in place and it'll stop you from leaking. At the same time, you don't have to take it out to go to the washroom. So the normal pressure of peeing you should still be able to do. It's just sitting in the vagina and supporting the urethra from underneath. And I like to just say that my best analogy that seems to resonate with women is it's like wearing a sports bra when you go for a run, or it's like wearing an ankle brace. It's just a support tool. And it does that by sitting in the vagina and under the urethra.
So will you talk a little bit about, let's start with like why was this even created? Let's go back to kind of the conception. Like where did this come from?
So we have an amazing founding physician. He's still involved in the business today, and his name is Dr. Scott Farrell. He was actually the second urogynecologist in Canada. And he was actually one of the first to start using pessaries to treat stress incontinence. Not to get too much into it, but pessaries at the time were more being used for pelvic organ prolapse. He ended up writing a textbook on this. He's been a medical professor. And I think he had just a moment where, a little bit of a light bulb moment where he thought, he's seeing, and I think wait lists have only grown over the last 20 to 30 years from when he was originally, when he originally started thinking about Uresta. But he was like, why isn't something like this more accessible to women? Like, why does a doctor have to be involved? Is there a way to make it so that women can self-manage and self-fit it themselves? And that was really kind of how the idea came to be with Uresta. And the way that Uresta works is it actually comes in 5 different sizes. So depending on your stage of life, how much support you need, hormonal fluctuations, you will need a different size Uresta. And so he built it or designed it so that when you go to get Uresta, you get a starter kit and you can test the different sizes and figure out what works for you. A lot of pessaries today that are prescribed by a physician, you might go into your physician's office, and some pelvic floor physios do pessaries as well, but you might get fitted for a pessary, you might leave, you might go throughout, do your daily activities and go, it's not quite right. And then you have to go back for a different size. Maybe the size you need might change depending on the time of month. Like I know a lot of women who need different size Urestas, right before their period, or they might wear a different size when they're going for a run. And so Uresta has this like starter sizing kit. So you have the flexibility to kind of change the size based on activity level or changes in your body. So that was like the first main thing was let's take away the physician fitting process and create it in a way that women can do it themselves. So self-manage. And then the second thing was to make it a more easier to use. So I have a Uresta here. You can see it. And for those who are listening on audio, it has sort of a tapered tip that makes it very easy to insert, but it also comes with a handle, and the handle makes it very easy to take in and out. And just a little bit of context, like we've done 4 clinical studies on this. One of our most recent clinical studies followed women using Uresta for over a year. And what we found is that 90% of women continue to use the Uresta pessary. When I think the SOGC did a similar study and looked at the use of more traditional pessaries, and at 1 year, compliance with women's pessaries was closer to 16%. And I think it was about 50 at 6 months. And not sure exactly why there's such a divergence, but from the urogynecologists that I've chatted with or pelvic floor physios to get their perspective, they feel like it's because Uresta is easier to use and because there is that sizing option.
Hmm. So,
Yeah.
and I think like one of the things that it's funny how often actually when I make the suggestion and just say like, this is another option.
Yeah.
And I use the same analogy. It's like a knee brace. Like if you want to play tennis, I'm still going to
Yeah.
get you to do exercises and do some strengthening and everything, but like I want you to play. And so if you
Yeah.
need a knee brace during that game or practice, then that's not a failure. That's getting you out. And same thing, like if you're
100%.
noticing you're running less or exercising less or hanging out with your friends less, I mean, why is this a bad thing? That doesn't mean you're just going to put it
Totally.
in and give up. But I do feel like there's a very negative connotation towards devices and pessaries. And I think that's just lack of information is my take on it. Because I mean, most women have used a tampon or a menstrual
Totally.
cup. And I wonder if we could talk a little bit about then the difference between for someone like you just showed the Uresta, but people listening won't understand. Like, can you describe the difference in like texture or feeling between like a Uresta, a menstrual cup, or the discs, and like an actual pessary that might be
Right.
fit by someone? Like, just describe the difference in kind of texture, feel, support.
Yeah, I would say texture wise, like very similar. Like our product is made of like a medical grade resin. It's similar to what you would find in like a menstrual cup. So it's non-absorbent, high quality, can be left on the body for a long period of time. I think the biggest difference, like, sometimes you'll look at a menstrual cup, but it's quite squishy, right? Because
Mhm,
it's not solid in the middle. Like our product is firm.
mhm,
This is actually I think our second largest size. But like I will show women this and they'll go, wow, that's big.
mhm,
And I go, well, first of all, there's different sizes. You'd be surprised
mhm,
what you would fit, but it needs to be firm because it's providing support to your urethra, right? So it needs to be, and when it goes into the vagina, it's kind of at a 45-degree angle and your urethra is kind of sitting above it. Like it needs to sort of almost, brace it, right? So like an ankle brace would be very firm. It's very similar, very similar. So I think that's probably like the biggest difference that women, I think, struggle with, especially when they feel it for the first time.
Well, and I
Yeah.
think it's just we're not used to putting that kind of device in. It's anything that's new. Like and I think we're going to get to this, but I think that's the benefit of, I mean, correct me if I'm wrong, but they try it. If they don't like it, they can return it, right? And that's the thing that I think a lot of people are, wow, I'm pleasantly surprised that I can't feel that. When I look at that, I
Yes.
assume I'm going to feel like there's something between my legs or between my lips
Yeah.
at all times down there. But
Yeah.
you're not supposed to feel it, correct? If they can
It
feel
should
it, they
be
have the wrong size.
totally. So like a tampon, like a menstrual cup, once it is in place, you should not feel it. Most of the time, if women can feel it, it's because they actually haven't pushed Uresta far enough in.
Hmm.
And it's almost like kind of if it's like protruding a bit. I think the best example is like if you put in a tampon, but you don't push it in all the way, that
Hmm.
kind of like just an uncomfortable feeling. But yeah, if you can feel it or it's really uncomfortable, you're likely needing a size down. If you're not able to urinate with it in, you're likely needing a size down. But yeah, I think that is one of the biggest maybe concerns or misconceptions about Uresta is that it's going to be painful and that you aren't able and women I think don't believe that they won't be able to feel it. And I think we mentioned this earlier, or before the podcast, but we have this Facebook group and we actually started it for that reason because I tell women till I'm blue in the face that it's comfortable, you won't feel it, that it works, all of that. And finally, I just was like, talk to a community of women who are already using it that are
Hmm.
loving it. And you'll see women go in there. And I would say a few times a week, I see the exact same post. I'm considering buying Uresta. Can you really not feel it?
Hmm.
And I think that's why I'm really happy we have the Facebook group. But yes, huge concern when it comes to Uresta.
So then walk someone through this. So they're thinking about getting this. They
Yeah,
order it online.
yeah.
It ships anywhere in the world.
So we are only available in Canada today. I'm actually
Okay,
really excited to tell you, but we just in April, so just a few weeks ago, got our approval with the FDA to sell without a prescription in the US. So
great.
we are currently available. We have, I guess, have been available in the US, but have required a prescription. Now we no longer require a prescription, and there's no prescription in Canada. So yes, the way to purchase it would be through our website. We're not in any retail stores currently.
And so then they would order, you would suggest they order the starter size or the starter
Yeah.
pack that comes with size 2, 3, 4, correct?
Yes. 3, 4, 5 actually. So
Three,
we
four,
have
five.
5 sizes
Okay.
from 2 to 6.
Okay.
Actually discontinued one.
Okay.
Yeah.
So they get that starter pack. Actually, can you talk about the price
Yeah.
so people understand? Like, what do they pay for that starter pack?
For sure. So it's currently retailing for $139. We
Hmm.
don't charge tax as a medical product. You're purchasing it through our website. We are currently offering free shipping. But you would get the 3 sizes. And basically, based on clinical studies and all the data we have, those 3 sizes will work for 90% of women. In a scenario where you feel like you need to try one of so we have 5 sizes, right? And you're only getting 3. So you're not getting the smallest and you're not getting the largest. In a scenario where you needed to try either of those sizes, we will just send it to you for free.
So then you would suggest they pick pick one, pick
Yeah,
one, try it. And you already mentioned like if it's too big, you won't be able to urinate or
yeah,
you'll have issues urinating or maybe it'll be uncomfortable.
yeah.
Give some reasons why you'd know it's too small.
So you would know it would be too small if it was falling out.
Hmm.
Of course, if you're not seeing any sort of leak reduction, definitely too small. But those would be like the two main things. I do think some women kind of get the package, go right in and try the smallest size. Sometimes too, if it's too small, it might like tilt a bit or move
Hmm.
around. So if you find like it's not like it should, once it's in place, it should stay in place.
Hmm.
So those would be kind of like the three main things to look for.
And actually, I should say that, like kind of mirroring what you said around people are surprised or shocked how big of a device can fit in there.
Yeah.
I one time with one of the local gynecologists, I was very curious to have a pessary fitting done. And I just had a lot of questions around like proactive use and just I wanted to know what the sizing or the fitting procedure was like. And when she pulled out the size and showed me what she was going to put in, I was like, no. And
Yeah.
this is like I palpate and feel people's vaginas all the time and I
Yeah.
still was absolutely shocked, but I can vouch for the fact that I did not feel the right size in there. And so saying I tell that story, I'm open about that when I pull out things like the Uresta to say like you just have to take my word for it. Our vaginas are bigger than you think, right?
Yeah. Yeah.
Um,
Yeah.
yeah. And so
Expandable, right? Like,
was
and
that?
it's expandable too. Like, I think one of the
Exactly.
things, like, it's funny you say that because there's a urogynecologist that I had sent the starter kit to, and she wanted to try it before she started recommending it. And she said, I was on her podcast, and she was like, I saw that thing, and I was like, there is no way it's going to be comfortable. And she's like, to my surprise,
Yeah,
tried it. So it's interesting to hear like a urogynecologist or to have like a pelvic floor physio to have the same
totally.
reaction in everyday women, right?
Yeah. And exactly like you're not going to believe it till you try it. And this is like,
Yeah,
everybody has to try and make their own decision.
yeah.
What happens? I'll never forget the first time I tried a menstrual cup years and years ago. I really was nervous to take it out and I had to like
Mhm.
comb through the instructions like how do I get this out?
Yeah,
Obviously like your product like that's kind of one of the reasons you have that little handle on it, but any
mhm.
advice for someone listening for inserting and taking out? Like
Yeah.
what do you suggest?
So my biggest thing is, or that my three kind of top tips I would say is first like relax,
Mhm.
because I think people get really anxious. And again, the Facebook group that we have is really great for communicating on tips for removing. There's a lot of women that were like, the first time I went to go and take it out, I was so anxious. First off, take a few deep breaths. If you're finding like you're really anxious or you try a few times and you're having a hard time, take it out. I honestly recommend like stop, leave, come back. It can be in your body for a long period of time. Like it's not absorbent. It doesn't carry like the toxic shock risk of tampons. It can realistically be in the body for a few days on occasion. We do recommend taking it out at night more to let the tissues breathe and rest. But if it was left in, it's really not a big deal. Same thing if you like go to bed and you forget about it, not a huge deal. So I would say like make sure you're relaxed. And then when you go to take it out, bear down like you're having a bowel movement. I would say most women like sit on the toilet and kind of mimic that or get into a squat or stand up and put one foot on the toilet, but making sure you're bearing down because it'll bring the handle closer to the opening of the vagina. And then when you go to take it out, I recommend before you pull it out, it will kind of, if you've ever used a menstrual cup, I think people will resonate with this, but there's like a little bit of natural suction that kind of occurs. So you want to either like tip it or like twist it before pulling it out. So yeah, so relax, bear down, and twist or tip it to kind of break the seal before you take it out. Those are kind of my three main things. We do have like an
Yeah,
extensive
exactly.
list on our website about this too, and the Facebook group is great.
And then what about inserting it? Because I think similar, like I have this
Yeah,
discussion when with people is like you have to angle a bit farther back than what you think. A lot of people are trying to
yeah,
go straight up. So can you
yes,
just talk a little bit about because they also like just describe how maybe like what your website or like
yeah,
how do they insert it? How deep? How do they
right.
angle?
Yeah, so it should be to your, yeah, I think some people are either like, I'm going like straight up or right to the side. Like it's a 45-degree angle. You should be like, once you kind of put it in, you want to push it in all the way. Like the handle should not be protruding. And the widest part, the bell part, should be past your pubic bone. Usually what I say is like, if it's in the right spot, it should be like, once you put your finger in, it should be like from the tip of the handle to the outside of the vagina. It should be about like an inch deep. To be honest, I would put, it'll come out a little bit, like it could move, just pushing it up a little bit more is totally fine. Like you can't push it too far. I would say, for women who have the right size but feel like it's uncomfortable, a lot of times they haven't pushed it up far enough.
Mm-hmm. Totally. I think people think it's going to get lost up there. It's not.
Sorry, you didn't hear my dog barking, did you?
It's okay.
Okay.
It's fine.
He was like distracting me, but
This, this is life, right?
I know.
Um, what about, because I know like, because with some pessaries, people can still have intercourse, but obviously like you can pee with this in, but no intercourse, you can't have it in when you have your period, right?
You cannot. Intercourse, no. I think our favorite FAQ on our website is, can I have intercourse with this? And we say, no, it would be a little crowded.
Yeah.
So no, we don't recommend it.
Yeah.
When it comes to menstrual cycles or using it during your cycle, realistically, we, as a Health Canada regulated product, we haven't had the opportunity to do a clinical study to make sure it would be, safe. I would say it'd be pretty messy too.
Yeah.
So no, it's not something we currently recommend at this time.
And you already talked about compliance, like some of the data on compliance. But like if I ask the question, like if someone asked me, how well does it work? Can you talk a little bit about some of the data you've collected on that?
Yeah, so we've been through 4 clinical studies. So they've all been focused on efficacy, safety. The one that I also talked about it being, compliance with it, like how long women use it for. In our most recent studies, the statistics were really strong. Just to give some context to the study. So it was a group of women. The average age, I think, was like 42, very active women. So runners, weightlifting, CrossFit participants. And in that group, I believe it was like 90, I should know it off by heart, but I think it was 97% of women saw a reduction in their leaks. And then 90% of them continued to use Uresta after 12 months. And then talking about some of the benefits, like 94% said that they felt more confident in public, and 92% said that they would recommend it to a friend. So I think the impact on quality of life is huge and more anecdotal, but like that's what we hear from women, like women who, run a 10K race and didn't have to stop to pee or didn't pee their pants and could push themselves, to women who are just wanting to enjoy time with their grandkids. It's definitely a huge quality of life issue. And I'm sure you know that as a pelvic floor physio and chatting with women.
Totally. And obviously like this device has been created for stress incontinence, but I'm sure, as is the case with other modalities and some people have symptoms, for example, prolapse, like low grade prolapse, heaviness and pressure. What are you finding? Is there any data? Do you have any data that suggests that it's helpful for other things? And again, I know that you never know. Like sometimes when people, maybe their most meaningful symptom is not stress incontinence, they have a bit and there's more of a, I can tell that they're just holding back from doing their favorite activities. There's almost like
Right.
obsessing about some of those symptoms. And sometimes I say, do you know what? This is worth a shot. Let's try this. Let's see what you think. Because some people will find that it alleviates some symptoms. But can you talk a little bit about, is there any data to support that?
Yeah, so all of our clinical studies have focused on stress incontinence, but I know from talking to a lot of our customers, there's a fair bit that have prolapse that are using Uresta. I would love to do a clinical study on this. So if there's anyone listening who would like to do a clinical study on Uresta for the use of prolapse, I think that's something we would like to do. But from what we've always sort of said is a low grade prolapse, Uresta is very helpful with. Usually a lot of women see success with it. A more advanced prolapse, I've always said you're probably not a candidate for Uresta because it will make it hard for Uresta to stay in place.
Mhm.
That being said, I've had a fair bit of women reach out to me more recently that have told me that they had very advanced prolapse, and they are like, Uresta is the first thing that has allowed them to work out and feel confident like working out. So, and I know, in particular, there was a woman, I would say she's about mid-50s. Her doctor told her to stop lifting heavy. She's been in fitness her whole life. And we know weightlifting is like really important for really all women, but very important during menopause. And I just can't imagine being told, not to do those things. The opportunity cost is quite high, right?
Yeah, absolutely. And again, you won't know till you try, right? Like
Won't know
you
till you
can't
try.
predict that. So you've mentioned, so I think I find it's a lot of athletic people. I find myself recommending it too.
Yeah.
Also people that like where we are in Kelowna, there's long wait lists for pessaries. And so sometimes I'm like, well, do you want to see what this does, while you're like, and again, I'm sometimes thinking of a continence pessary for them, but
Yeah.
they've already been told maybe by their GP that they should consider a pessary. So they're thinking it. They haven't thought of something over the counter, so I might suggest it for them. But can you talk a little bit about some other special populations? Like, I'm curious about the postpartum population. This is a time where a lot of women feel held back by those symptoms. Um, I mean, again, we've kind of touched on menopause. I'm sure a lot of these women would benefit from some estrogen on top of the
Mhm.
Uresta, just like they don't usually want to insert pessaries without estrogen. Like, can you just talk a little bit about special populations there?
Sure. I mean, we can start sort of with postpartum. So absolutely postpartum. Obviously, wait till you feel comfortable inserting and
Mhm.
kind of getting clearance from your OB. But absolutely, it can take over a year, to get to a place where maybe you're not leaking. Maybe you're working with a pelvic floor physio and you're going through a treatment, but you want something to rely on in the interim. I think that really anyone who's working on their pelvic floor who just wants that immediate relief, Uresta can be a really helpful tool for that. As you know, some women aren't able to fully eliminate leaks with physio, so they might rely on this. But postpartum, definitely a lot of athletic women, a lot of, I mean, it doesn't have to be super athletic. Like, yes, we have a lot of runners. I think um, we've just found that there's like a lot of word of mouth around among runners in Canada, and it's really common. I think the stat is like 50% of women who do high impact exercise will leak. So of course, women just using it when they work out, but then there's like women who are like light walking. There's women who are traveling. They don't want to bring a bunch of pads on their trip. There's women who just really want the confidence, whether it's a work setting, a social setting, women going like women message me, oh my God, I had so much fun dancing at a wedding, horseback riding, swimming. There's just so many different activities where women are just really, I mean, it happens all the time, right? So I would say that. And then, of course, like we have some women who just use it right before their period. Like that's the only time they leak. Perimenopause, as they start to get into that, get into menopause, postmenopause. Like I have women that I know of as young as 28 and as old as 80, which is impressive because, we talked a little bit about removing and bearing down. You might have to squat a little bit, like having proper dexterity in your hands. That's important as well. I've even had a fair bit of MS, women who have MS that are using it to help with bladder control. So definitely a lot of different types of customers.
Listen, I think it's a very reasonable price considering how much pads cost. And I think about the people that would say, I can't stand the odor of urine. And so a lot of them are buying their Lululemon tights new
I
long
know.
before they need to because they don't like the odor. And like a pair of Lululemon tights cost the same amount, right? And so, I mean, I
Yeah.
think it's a very fair price. I'm curious to know, Lauren, like, do you ever get insurance companies that will pay for it?
So Interesting you say on price. I will say, like, we've sort of relaunched as in the last couple years, and we've been really focused on like spreading awareness, getting people to try it, get them over that barrier, right? Like what we talked about earlier in this podcast, like just try it. If you think it's not going to be comfortable, just try it, like trust us kind of thing. And so I think we've really angled on things like, let's have a really affordable price point. Let's make sure like we have a 30-day money back guarantee, all of those sorts of things, just to really like get things going. I will say on the insurance side, like as a newer company, I mean, our awareness is low. We're not a big company. We don't have insane resources to sort of market the product. But I'm surprised how many insurance companies do not cover it. I will say most women are able to get it covered if they get a prescription. I really have tried to get women who get a no to really push back, because I'm hoping the more that they hear about us, the more likely they would cover it. I mean, we are considered a pessary. We would fall under incontinence supplies. It's just whether or not that prescription is required.
I find that I usually try for people. I say, would you like me to send over? Like, I usually kind of like create a little PDF for them. And I say whether or not they'll accept this from a physiotherapist, but we can try. So
Yeah,
I usually try if they want me to. And I usually ask them to like, let me know if it ends up being covered, just so I understand.
yeah,
I don't always hear back from people,
yeah,
whether or not
yeah,
they order or whether or not they try to submit to insurance or whether that's a yes or no. But it
yeah.
doesn't hurt to try, right?
It doesn't hurt to try. I also think like I encourage people to try, and even push back, just because even if you don't, if you get a no, like maybe enough people asking about it, it'll change things. I have heard of people being like successful, kind of calling it an orthotic, which is
Mm-hmm.
kind of interesting. Thinking about it in that perspective, going back to kind of the ankle brace comments,
Mm-hmm.
it's kind
Mm-hmm.
of interesting.
Well, I think also too, I mean, people are starting to hear more and more, and I've done numerous episodes, whether it be with
Mhm.
other physiotherapists or gynecologists, urologists. And like we know, like I'm just going to use incontinence as an example, but we know like there's different um suggestions for how to treat incontinence based on the level of evidence. So we kind of know there's certain things we start with, and there's certain things we would consider a little bit more farther down the spectrum of options. And we know surgery is one of those ones to come later down the road. And
Mhm. Yeah,
something like this, like a continence pessary, falls ahead of a recommendation for surgery. And so I think people are
good.
starting to open their minds to other options, and most people want to explore those options first. And I mean, I think that's what a lot of the surgeons will say too. Like, they want good outcomes, right? Like at the end of
Totally.
the day, they want good surgical outcomes. So I'm
They
finding
do.
more and more referrals from, for example, we're talking about incontinence here. So urologists, in my case,
Yeah,
would be the one sending more often for the incontinence. And
yeah,
it's always like, let's start with something like a pessary, estrogen, physiotherapy, and then come back and we can talk about surgery later. Whereas that
yeah.
never used to happen. And so I think people are really interested in their options. And at the end of
Mhm.
the day, like I kind of think of all those things I listed at the beginning of this episode as almost like a menu, and not everybody chooses the same thing. And some
Totally.
people are like, absolutely, I'm going to try a device first. To me, that's the low hanging fruit over something like paying for physiotherapy. And other people are the opposite. But I
Yeah,
think just understanding that a lot of us physios will also recommend the device, because
yeah,
I would never claim that, there's one thing that's going to help everybody. Like it's just healthcare is trial and error.
totally. And I mean, we get a lot of comments like, "Oh, shouldn't you just go see a physiotherapist?" And I think it kind of you brought up the point earlier about almost like shame.
Mhm.
Um, and that's always frustrated me because, um, you know, one, you can do physio and you can do Uresta. It's something that, you might rely on for a while before, you're able to fully manage your leaks without the extra support of Uresta. And if you need the extra support, like you shouldn't beat yourself up over that.
Mhm.
And I've also had women that have messaged me and said, "Oh, I'm just really busy right now. I know I'm taking the easy way out, but I'm going to use your rest and not go for physio." And I'm like, you are not taking the easy way out. It is a quality of life issue. Like,
Mhm.
And if you're holding back in other areas of your life, whether it's work or social or being active, like what's the opportunity cost there?
Mhm.
Uh, and I think that's one thing I'd really, I try really hard. And I think we try with some of our comments on social media to really like change people's perspectives. But
Mhm.
yes, there's a menu of options out there. Uresta is just one, but you certainly should not feel guilty.
No, and I think about the number of people that associate pelvic floor physios with internal exams, and that's not what they want. And again, I think it's like I don't want to say unfair association because some physios would kind of require that. But like in my case, I'm like, I would never do that if you don't want to. But some people
Right.
would much rather order something online and self-insert before they see someone that they associate with an internal exam. And that's fair.
100%. That's totally fair.
Yeah,
I mean, I've had friends that have, had babies and they were kind of anxious about that pelvic floor exam or experience. And yeah, you're right. It doesn't have to be that way. But a lot of people have that thought, or maybe there's past trauma. Like there's a lot of reasons why people might not be comfortable with it. So I totally get that too. But one of the pelvic floor physios that we've followed a lot, and she uses Uresta. Her name's Carolyn Packard, and she's on Instagram, but she talks a lot about full body strengthening and how some of the moves you can do are way more effective than doing a Kegel, right? And it has nothing to do with an internal exam,
totally.
right?
Um, Lauren, anything else that I haven't asked you that you feel is important to get across here?
That's a good question. I feel like we covered a lot. I would just say like we really try to give as much information as we can. We know Urus is a bit of a different product. I know you're doing a lot to educate women about pessaries and Uresta and other bladder support products. I think if there's people who are wanting to learn more, like we've really built our website to be really full service. There's a lot of information on there. We have a web chat, we have email. And then I did mention our Facebook group. We have this Facebook group called the Uresta Insider Group. It's a mix of women who use Uresta, some that are on the fence and have questions, but whether you are trying to figure out if it's right for you or you have questions, there's no one better to talk to than our current customers. So it's a great place to join. So I highly recommend our website and the Facebook group.
I'll make sure to link all that in the show notes.
Yeah.
But I really appreciate your time and your product and all the work that you're doing to try to spread the word. Um, and I hope we can connect again soon, Lauren.
Absolutely. Thank you for having me and for all that you do.